Hello. Today we will be discussing the case of a 45-year-old male who came into the emergency room due to a motor vehicle accident. Also, the severe injuries that this patient sustained because of this accident. We will also go over the X-ray procedures that were performed, the technical factors involved in this procedure, as well as discussing the final diagnosis for the patient. Motor vehicle accidents are one of the majority of causes of severe internal and external injuries in patients that come into the emergency room. These accidents can be very traumatic events, and some are even fatal. One of the most painful injuries that result from these type of accidents is rib fractures, which can also be diagnosed as flail chest. Flail chest consists of 3 or more ribs that are broken in at least 2 places. Flail chest can cause long-term problems such as chronic chest pain, deformity of the chest, and shortness of breath. In some cases, however, people are able to regain normal lung function within 6 months, even if there is still a deformity in the chest. In this case study, a 45-year-old male backseat passenger was involved in a high-speed motor car accident during the middle of the night and crashed into another vehicle. He was immediately rushed to the hospital and was assessed by the attending physician. A portable chest X-ray was ordered for this patient to be able to rule out any fractures and any other injuries. For this patient, we received the order to perform a portable chest X-ray in the trauma bay. It is very important to always look at your patient's medical history to determine what caused the injury, as well as knowing in which state the patient will be. In this case, the patient was going to be extremely fragile. They were laying on a stretcher, they were unable to stand up, and they were in an excruciating amount of pain. So, although introducing yourself to a patient and explaining what department you work for is crucial, most likely you're going to be in an emergency situation. So what I did in this situation is I decided to quickly verify his date of birth, looking at their bracelet, asking him if he was able to confirm it for me. And I, calmly told him my name and that I would be performing a portable chest X-ray of his chest. A 14 by 17 cassette was covered with a plastic case, placed lengthwise underneath the patient, centered to the patient with the top of the IR approximately 2 inches above the shoulder. The patient was in a supine position with no rotation, and luckily the patient was able to roll forward the shoulder slightly. The central raise for this patient was 3 to 5 degrees caudal from perpendicular to sternum to prevent the clavicles from obscuring the apices of the lungs. The SID was used 48 inches, a KVP of 125 with an MAS of 8, and the exposure was taken on expiration after the second full expiration. The X-ray demonstrated the following findings. A segment of the thoracic cage was separated, most likely due to the blunt chest trauma suffered during the accident. The radiograph also demonstrated multiple rib fractures, with some of the ribs fractures in 2 or more places. A pulmonary contusion and the subcutaneous emphysema were also clearly seen. The patient was diagnosed with flail chest. Flail chest happens when 2 or more ribs are fractured with 2 or more breaks per rib. This is a severe injury, extremely painful, and usually occurs due to severe blunt trauma. The chest wall is perforated, which can cause a segment of the chest wall to detach from the rest of the chest wall. A chest X-ray in conjunction with CT is always going to be ordered first to be able to diagnose a patient with flail chest. Younger people who are healthy they recover quickly without any complications, but elderly patients are more at risk of acquiring a pneumonia or going into some sort of respiratory failure. In extreme cases, the chest wall can completely collapse or cause severe internal bleeding. And But however, in the majority of these cases, recovery should be quick. Could be a couple weeks, could be a couple months with the appropriate care.